So now it's time to Shelly Varod, is a psychologist, certified sexology from Tel Aviv, releasing a talk on what women want, so especially the social aspect of the issue. Please, Shelly.
Thank you very much for having me here today, and thank you, Freya. So what women want, I know I only have 15 minutes, and I wish I had 50 days for it. I will start with disclosure, and there is none. But before I'm going to start my lecture, I do want to tell you a little bit of a story. A month and a half ago, I was invited to the University of Ben Gurion, which is a very big university in the south of Israel. This was an open lecture about sexuality, to talk about men and female sexuality, explain to them more about spicing up their sex life, and giving them pretty much reliable information. On my way there, I heard it was sold out, 250 people. I was very excited. I get to the hall, and I look at the crowd, and what I realized is that out of the 250 people, I probably have 248 women and 2 men. I think one of them I knew. So I guess what women want, at least the students at the University of Ben Gurion, is information. What happened to the men, we are going to try to guess at the end of my lecture. So in order to understand what women want, it's very important to go to the beginning. The sexual scripting theory that exists in the 70s is one of the theories that really help us understand how we learn about sexuality from a cultural perspective. So script is actually a guide or norms that are appropriate to every culture. So every culture, we're going to have different norms that related to sexuality. And of course, it's also socialized in a way that differentiates us between men and women. I like to use the sexual script theory. I still see a lot of clients at the clinic who I can see how they follow this script and how they were brought up according to this script. But what I truly like about it is that they compare it to actor. They say we don't just show up to bed and act on an impulse. We're actually having a certain sexual script according to our culture, and then we get the sexual interaction. So, as I mentioned, sexual script is also according to gender roles. Let's start with important component about the male from the beginning. So penis owners are, as we can see, can stand in front of the mirror, right, and look at their penis, which makes them get connected to their, at least normalize the look of their part. When they are taught how to go to urinate, they are already getting the permission to touch it, direct it straight, because we don't want the toilet to be dirty. And in a sense, they start getting the sensation of feeling another part, which is the intimate part in their body. They get the feeling that this part is not dirtier than any other part, and they also learn that it feels good to touch it. During the teenage years, of course, when they start to masturbate, they connect the sensation from their penis and the intimate area to pleasure. They get in touch with their body, and they learn about the relationship between their body to a pleasurable experience. So in their first sexual experience, when they interact with another partner, they tend to be, and sometimes they stay like that for many years as well, in terms of sexual behavior, more goal-oriented, less focused on their partner, and focus more on self-pleasure and tension relief, right? So let's look at what happened to women, important component, in the same way we looked at men. So, vulva owners. So girls are not really taught to touch their genitals, and definitely not the clitoris. I don't even think many women, at least from what I see, my clinical experience, understand or where is the clitoris. And some of them even come and say, I don't think I have one. And I'm like, you do, I will help you find it. While urinating, it comes with instructions. Unlike boys who can touch and feel and miss, and it can be a little bit more playful for some parents, girls have specific instruction in order not to move the bacteria. So they already learn it has to be done in a correct way, not to, because this area, the vulva and the vaginal area has to remain clean. It's also very difficult for girls to see their vagina. Even at the clinic, I'm like, just take a little mirror, bend down, spread your legs, and try to explore your part. I still have a lot of women at the age of 20 and 30 who have never seen their vagina. They feel very disconnected, and we know that it can also affect their pleasure. Less experience with masturbation compared to men, unfortunately. I don't feel that women are broken if they don't masturbate, but I do feel that it's a very positive experience when they feel comfortable to experience it in order to understand what provides them pleasure and what doesn't. So the other issue with women, on one hand, it's good. They do receive more sexual education than men because women can get pregnant. But in a sense, they start to understand that they need to be gatekeepers and then that there are dangers and risk. No one is getting, at least for my 10 years of experience at the clinical, I don't see parents who tell them, it may feel really good when they touch you or magical, and give them permission to be touched, understanding that there is pleasure involved and not only risk and dangers. So their sexuality is related more to self-protection and behavioral restraint more than physical pleasure. So I'm going to show you the male role according to traditional sexual script, and then we will look at the women. I think my dancers also convey what I wanted to say. So these men desire sex without necessarily being desired. They, of course, have strong sex drive. They initiate sex. They're super skilled, at least they're expected to be, prefer recreational sex, value sex over relationship, no string attached sex style, and of course they want multiple partners. Sometimes they title as players. When we look at the women role according to traditional sexual script, so they are desirable but not desiring sex. This is an issue I still see a lot. I see a lot of women who, even in a relationship, are so scared to initiate sex when they desire sex. And it's like, I need to give them permission. And I sometimes tell them, you can text, you can flirt, but it's okay to even say, I want to have a sexual intercourse with you today. They are perceived, according to the traditional script, with a weak sex drive, resist advances in exploration in bed. If they're less experienced sexually, of course, it's perceived highly respected, and they are perceived as want relationship, monogamy, trust, emotional intimacy. We do know that there is a move away from the traditional script, and this is a very interesting research because I can see the gap sometimes between couples I have, and I can see how some of them remain believing in traditional script, and some of them are thinking way beyond creating their own script. What was interesting about this research is that they interview 44 young men and women between the age of 20 to 25. They're all from the United States. And when they interview them, they all describe the very traditional feminine masculine script. But when they talked about their sexual behavior, they realized there is a huge gap between the two. They divided two categories. Of course, the first one was the unquestioning conformity, the group of people who actually believe that the masculine and feminine role in sexual behavior, they're normal, they're natural, they're inevitable. And if I quote one of the women, men have strong sex drive and women have a weaker one. But there is also the conflicted conformity. They feel conflicted because they know they need to follow, or they sense inside of them that they need to follow this script, but they're not truly satisfied with it, but they're not sure how to change it. Then we have the exception, which is the group that I truly like because they find exceptions to the gender rules. And let me quote, this mic, sorry. I was known as one of the girls that was really hard to get. I was really, really selective. I only picked the one that I knew were going to keep me private because I had such a busy sexual lifestyle that I didn't want it to get out there that I was a whore. I mean, I was getting around the block, but nobody knew. And the last group that they mentioned was, categorized, one second, stuck, is the transforming. Some of the things I really like to do with the clinic, I help people transform or create. This is the beauty about script. We could write whatever movie we want, right? And I teach them how to write a script together with men and women and create their own sexual script. So with the transforming, she was saying, I was in a relationship for a long time. I was used to having sex, and I wanted to keep having sex without string attached. If I wanted to have sex, I could just call somebody and they would come. And I know a lot of guys have girls like that, and I figured, well, why can't I? And she laughs. So what women want. McHugh was a sexual educator for over 25 years. What was beautiful about her work is, besides talking about the medicalization of female sexual function, she also reviewed and read over 2,000 journals along her year of being sexual educator for undergraduate students. Although her list is long, I do want to focus on the four aspects that she mentioned. So one of the things, of course, that we're also aware of it since the Me Too movement is the consensual sex. But of course, a lot of women report in their journal that they were going through unconsensual sex, and of course, it's very disturbing. But many of them said it was consensual, but you know what? It was not really satisfying. I did not have a good, satisfying sexual relationship there. She also mentioned that women want sexual agency. Women want, and they know their sexual being. Women want to be free to experience, to be free to explore pleasure, but they're also very restrained by their culture. And they know that if they're going to be tagged, especially young women, it's going to be very difficult for them to survive, through high school and through college and sometimes even after. And she also mentioned women want a relationship. I believe in a relationship, besides the love and intimacy and communication and support, there is also a place for some women to feel free to explore their sexuality and maybe feel that this is the place my culture is giving me permission to be sexually active. So about sexual pleasure and desire, we know that men and women are equally capable of sexual pleasure in terms of their biological and psychological. We also know that they're equally arousable as long, of course, as they are stimulated appropriately. But our gender culture script, the one I presented, and of course there is much more into what I presented, they may inhibit sexual desire. So as men learn to desire sex, women learn to prioritize others' needs above their own. And it definitely happened a lot in bed. And we can also see it in the sexual pleasure gap and orgasm gap. Of course, I'm referring to the male-centered sexual script, which is mainly penis penetrating a vagina. And the orgasm gap refers to mostly men will achieve orgasm. Women will achieve orgasm only if they will feel free to touch themselves, add stimulation to the clitoris. Because sometimes on certain sexual position, we know it's very complicated for the men also to penetrate, also to try to pleasure her. But she also needs to give herself permission to do it, to be free, to enjoy. And that, of course, if she understands how to bring herself to experience orgasm. And when it comes to pleasure gap, there is a lot of body of research that show how women sometimes, many times actually, feel pain. But somehow they feel like pain is normal. But the pain eventually leads to a non-pleasurable experience, definitely through penetration, and can inhibit their sexual desire. 2 days ago, I received a message from a woman who is telling me she's suffering from pain and if physical therapy is going to help. And I said, well, pain should not be a part of intercourse. And she says, my mom, my aunt, and my sister just told me that this is how sex should be. And I was shocked how it's go through a generation and they still don't understand. And they said, maybe one day it's going to go away. So I told her, we're going to help you adjust it right now because she was not enjoying her sexual experiences. Sorry. Oop. Okay. So we're talking about medication today. We know that female sexual desire receives a lot of attention since the success of Viagra. We also know that there is a lot of research that is amazing research, to be honest, out there that is exploring women mainly from physiological and physical causes. But when we look at the new view of the female sexual problem, it's actually a group of feminists that exists since 2000. They are all experts in the field of sexuality, psychologists, sociologists, sexual experts. So they believe that desire, attraction, arousal, and satisfaction are also shaped by many psychosocial elements. And their age, their relationship, the neighborhood they grew up, the country, the culture are all affecting. And their belief is saying that if we truly want to understand women and we want to know what they like or don't like, let's go and talk to them. Let's understand about their experience and let's understand how the male sexual script also limited women's sexuality. In this way, we can help them. And this is my last slide. I don't even know how much time I took. But in the sense of going asking women about treatment and sexual therapy, that's me, sorry. Okay, Dr. Kobe Reisman and I decided that we are going to go and we are going to talk to women as much as we can. We're at the beginning of a research, and we asked them, premenopausal women, if they're interested in drug treatment. We used social media pages, and we had over 1,493 women answered. And we, of course, wanted to check who is experiencing low to no sexual desire, at least in the past 6 months. 49% reported no decline, 42% says they have low sexual desire, and 9% reported that they do not know. Then we asked the women who are reporting for no sexual desire for at least 6 months, if they would be interested in drug treatment. And to be honest, I was even surprised because these are all considerably young women, premenopause. So 40% said, nope, we're not interested. But 26% said they're willing to use drug for HSDD, depend on the risk and benefit. 22% said they are interested. They did not care whether the risk involved. And 12% said they still do not know. So we concluded that women do prefer products that have undergone extensive testing, safe, and are effective. Thank you so much.